Welcome everyone to another episode of the Chuck Graham Show. I want to touch base on some things today regarding these masks. I've done a lot of research and we're about to get to it, so stay tuned. Well, welcome back. So let's get to it. The mask, the homemade mask, the mask everybody's wearing, they're becoming a fashion statement, and there's a lot of misinformation out there. But I will say this, there is no data whatsoever in any study that proves or shows that those masks actually slow the spread of COVID-19. None. I've looked. There is a study by the CDC, and let me get it pulled up here. And I'm going to put links in the description as well. Now, this is not my opinion. This is from the CDC back in 2008. The National Institute of Occupational Safety and Health did a study, and basically that study, they wanted to see if surgical masks that have been used since the 1900s, if those surgical masks would stop the respiratory illness or a virus or infection for respiratory illnesses. And their conclusion was, and I quote, "None of these surgical masks exhibit adequate filter performance and facial fit characteristics to be considered respiratory protection devices." That's a quote from the CDC study. That's not my opinion. That's a quote from their study. Well, just 2 days ago, we had another study that was done by the New Zealand, and it was their Ministry of Health. They released a report. Number one, and you'll have to go read it because it's very interesting. Number one, there are no clinical trials on the efficiency of public face wearing coverings to protect against COVID-19. Therefore, evidence is being pulled from indirect research. Much of this is around influenza, SARS, in clinical settings, or N95 versus surgical masks, for example. Now, the World Health Organization, this is the number 2, the use of masks made of other materials, cotton fabric, also known as non-medical mask, in the community setting has not been well evaluated. There is no current evidence to make a recommendation for or against the use in this setting. Now, it goes on to say, number 3, the debate about public use for face mask coverings is heated. Based on the non-systematic review, the Royal Society Delieve, I can't pronounce that, but it's initiated support public initiative supports public mask use. Okay, but number 5, the report has been criticized by other scientists, warning that it amounted to no more than an opinion and overstated the available evidence. That is not a piece of research. That is a non-systematic review of anecdotal and non-clinical studies, said Dr. Anthony, and I can't pronounce his last word. He's from the University College of London, and you can read it. But basically what he says, he's based on what we know about COVID-19, the negative effects of wearing the mask outweigh the positive. That's his professional view. And then 6, this is going to be my last one that I read to you. But number 6, it says, the CDC recommends the use of face masks, but cannot find any data to quantify the risk reduction from wearing the mask. The CDC is recommending that you wear something that they have not, they have no data to support the recommendation. None. In fact, it goes on to say in this report that it most likely will make people feel falsely secure, so they won't social distance. We know social distance works too. I mean, you stay 6 foot away from somebody. you're less likely to get it washing your hands. You're less likely to get it. Now, there's another argument to be had on herd immunity when it comes into that. I'm not going to get into that. My focus today is going to be just on the face mask. Do they work? No. No evidence that they do. Do they make you feel more secure? Yeah, probably. But let me tell you, if you're breathing in and out your own carbon monoxide, and you're breathing, and your mouth is getting wet, and saliva is collecting in it, and all that. My wife, she had a graduation that she had to run. It was yesterday, and her throat started getting sore. Her nose was burning. It's not healthy to me. It's not healthy, and there's no evidence to show that it curbs the spread of this virus. I'm sorry, it's just not. There's no evidence. I mean, I want facts. It'd be different if I found some evidence that it did, but these government authorities are saying no. They don't prevent you from getting it, and it's questionable if it prevents you from spreading it. And according to these professionals, it doesn't. It actually could make it worse. You touch a surface, you touch your dirty mask. You touch another surface, you get the corona on the front part of your mask. You touch something else. It could, and not to mention the health hazard. Think about when people, everybody's not cleanly, right? So think about the health hazard when they take those masks off, throw them away. They dispose of masks in hospitals in a specific way. That's not to say that you're going to do it when you throw it in the trash and it ends up in a landfill somewhere, or you throw it down, or you throw it out the window, or could that not possibly cause a health hazard? Certainly, I would think. So the point being is this. Well, and we don't know. Let me just say this. And we don't know if the chemicals that fabric that you're making these homemade masks out of, what it was soaked in, if it come from China, or if I tell you what, take a rag and soak it in gasoline, then wash it. You're going to still smell that gasoline. We don't know what chemicals are in the fabrics that could be harmful if we're inhaling those chemicals. With surgical masks, that they're made for you to cover your face and breathe in and out. These homemade masks, and I'm no doctor, and I even pretend to be one, not even a nurse, but I have a suspicion that after this is over, you're going to see a rise in respiratory issues from people wearing these masks and inhaling whatever chemicals that they've made those masks out of. So I'm not wearing the damn thing. I'm just not. So, because there's no evidence. But I tell you, I don't want to be breathing in from a homemade mask through material that I don't know what it was made out of. I don't know what it was soaked in. There's going to be repercussions for this, and the CDC is going to have to answer for it, because 6 weeks ago they told you not to wear a mask. 6 weeks ago the Surgeon General said stop buying them and don't wear them. They don't work. And I'm gonna put his. If I think about it, I'll put his tweet in the comments as well. So the bottom line is, this is coming from professionals. Now, why all of a sudden are they doing an about face on this? And my theory, and I said it in the other show, my theory is comfort food for the panicked. It makes you feel like that you're doing something to protect yourself, and that makes you more susceptible to get out and do things. Folks, I don't care if you're going to die, you're going to die. But if we don't have some sort of, I think we're hurting our immune system by all this. And like I said, that's for another show. But in my opinion, and according to these studies, these masks don't work. And there's no evidence to show that they do. And I've sent emails to the governor. I've sent emails to our mayor. I've sent. I sent this. I also sent this over to the attorney that's suing the governor in Connecticut. And I thought about doing a pro se litigation and suing the city as well for making this stuff mandatory when the CDC, it's a voluntary recommendation. But here's the thing. And not because of that, but because there's no data that supports the reason why they're making you wear these. But I'll tell you what they have captured. They've captured the fear. When I watched that stupid-ass judge over there in Dallas, Texas, sentence that woman that owned that salon, and everybody in that courtroom had a mask on, I'm thinking to myself, where is the data? So you've got the fear of the executive branch of our government combined with the fear of the judicial branch of our government with no data. None. No data at all that supports the wearing of these masks to slow the spread. But yet they recommend it. Why? Now, all these people making these masks are making a lot of money off of them too. At $10 a pop. So the fact of the matter is this. I'm not wearing one of these homemade masks. I don't know what that material was in and what chemicals I'm sucking into my respiratory system. So, yeah, that's a big fat no. But I am going to print that out right there. And I hope I don't have to sue. I hope that they don't try to force me to wear one of these, because I got court on the 20th. And if I can't get access in there because I'm suing. I'm going to sue the state, the city, and the county. I mean, like I said, I read the 47-page complaint from that attorney in Connecticut. I'm watching his case. I want to see how well it goes. But it's a crapshoot, because you've captured the fear of all our branches of government. And they're making decisions not based on data or facts. They're making decisions based on fear. Now, is that ever a good thing? No. So, folks, all I can tell you is, be safe. But I don't think it does you one bit of good, according to these stats, to wear those masks. God bless, and be safe. And I'll see you on the next video.